Okay, awesome. I'll give it a couple more seconds for people to join until it turns 6 exactly. Okay, so welcome everyone, and thank you so much for being a part of our second webinar. My name is Brooke. I'm a senior at UConn and a youth partner for Be a Part. I'm so excited to be here with each of you this afternoon in efforts to answer one important question together. This is the same question we aimed to answer during our last panel, that being, how can we keep our most vulnerable communities safe? Be a Part is a youth-driven campaign that brings together the strengths of scientists, young leaders, and local activists in order to rebuild healthy and resilient communities in the face of COVID-19. Our main goal is to educate, support, and provide hope in order to allow young individuals to help their communities through efforts of volunteerism and activism, but also while doing so safely. Our webinar today supports this by ensuring that everyone, especially our most vulnerable members of our community, are protected. That being said, how can we keep our most vulnerable communities safe? My co-host Kate, a junior at Yale and Be a Part youth partner, will explain our thought process behind this panel.
Thank you so much, Brooke. I would love to explain our thought process. Early on, it was thought that COVID-19 was only going to be a short inconvenience. We now see, however, that this may be our reality for quite some time. With going back to school, we have unknown territory we're now entering, so it is crucial that we begin to understand how to navigate in these unknown times. Returning to school involves many new interactions. Individuals will be moving to and from college campuses, and grade schools will host gatherings of individuals that would not otherwise be in contact. With all of these moving parts, there may be many uncertainties that arise in relation to the virus. How we address these uncertainties now during this pandemic will determine how safe we'll be able to keep our communities. We as young people are in a unique position to make change. This webinar aims to bring together 4 unique perspectives from Connecticut into a single conversation about what's going on in our state and how we can operate from here as communities continue to suffer in the face of COVID-19. Brooke will now introduce our panelists.
Thank you, Kate. So a little housekeeping. We're going to introduce each of the panelists, and they'll each have 3 to 4 minutes to introduce themselves and share some initial thoughts before moving into the Q&A portion of the panel. This is also only our second panel, so if there are any technical difficulties throughout the webinar, please be a little understanding. With that out of the way, our first panelist is Dr. Ann Wyllie. She's an associate research scientist at Yale, lead researcher in the making of SalivaDirect, which is the new COVID-19 testing method developed by Yale and funded by the NBA, and was just named a 2020 hospital hero by US World News and Report, which congratulations, Ann Wyllie. Can you please tell us a little bit more about yourself, your work, and what you have seen over the past 2 weeks with the students returning to school?
Yeah, sure. So great introduction. Thank you very much for that. So indeed, I'm currently a scientist at the Yale School of Public Health. My background is in medical microbiology. So I have been studying sort of other upper respiratory tract pathogens before this all started, with a particular focus on a bacteria called Streptococcus pneumoniae. And some of my early research during my PhD actually led us into looking into the detection of the pneumococcal bacteria in saliva as compared to the gold standard nasopharyngeal swab. So while I was not at all expecting to be in this realm with COVID at all, and of course it's been a lot of unexpected things have happened over the last 6 months, it has been, I guess, very coincidental that I'm now entering a world where again I'm challenging the gold standard nasopharyngeal swab with saliva testing instead. So indeed, Yale formed this really amazing emergency response very early on in the pandemic, where an incredible group of researchers, clinicians, students, public health students, med students as well, just really banded together to establish this biorepository. So what this meant is that as COVID-19 inpatients were coming into the hospital, we were collecting samples from them with the idea that we could use these samples for research to find out more about SARS-CoV-2 and COVID-19 disease progression. And this is what really led our development into finding that saliva was actually a really interesting sample type to be looking at for SARS-CoV-2 detection, and has also really thrown us into this whole testing realm. And I think really, especially over the last 6 months, I've spent a lot of time, a lot of hours each day speaking to different schools, to universities. Everyone has been so eager, desperate, keen, hopeful about what sort of testing strategies they can get up and running, because they've really seen that it is a very important part of us to be able to return to the school setting. So indeed, the last 2 weeks have been very interesting to observe. I think one of the most striking ones to me has been University of Illinois, where their school has set up the most phenomenal testing program, I think, out there, and has been a real inspiration to what other universities can and could do. But even, having an amazing testing strategy in place, it also just shows that, sort of human behavior does still need to be considered in there, because they are still seeing a lot of outbreaks, unfortunately, that hopefully we can, I think it just shows sort of, we can prepare so much for one thing, but, we really do need to be prepared for all the little gaps in the testing cycle, and just having people coming back and being together. So that's what I think, especially Be Apart has been really good at, sort of thinking about as the community as a whole, and what we can do to actually keeping each other safe personally as well, rather than just relying on just testing strategies alone.
Great, thank you so much, Dr. Wyllie. Our next panelist is Dr. Verna Ruffin. Dr. Ruffin is the Superintendent of Waterbury Public Schools, which serves about 18,000 students. She pledges to make Waterbury a leader in the state for urban education reform, performance improvement, and efficiency. Dr. Ruffin, could you please introduce yourself and tell us about what you've observed in Waterbury in relation to returning to school?
Thank you, Kate, and thank you everyone for having me here. Yes, lots to observe over the last 2 weeks. I've been superintendent of Waterbury for the last 2 years, and of course we were making strategic plans and improvements and academia, and certainly creating innovative programs for our students. And then on March 13th, our world changed as we once knew it. We were at that time not poised to begin implementing a one-to-one device and the technology for teaching and learning. So we found ourselves to be examples of what we expect our teachers, our students to be. When we tell our students, you have to think critically, and sometimes you have to make mistakes, but you have to struggle and then derive the answers. And we found ourselves as adults doing that very same thing. And it was not as easy as we were saying to our students, of course. So what we found in the last 2 weeks is that it was, we returned our students on September the 8th, after many, many weeks of planning what that could look like, both giving the option of in-person return as well as the virtual academy. What we found is that prior to even implementing that plan, it was beneficial to reach out to our families, to our community, in community forums, which were very well attended by parents and teachers and various union groups that we work with here in Waterbury, our nurses, our paraprofessionals, our maintainers, our food service staff, to connect so people could understand the complexities of what we were getting ready to do, but also to find out some key factors that were critically important for them as they felt comfortable either coming back in person or making a decision that they were going to choose virtual. What that did for us is that it allowed us to be able to develop this hybrid model, which allows our students, approximately 40% of them who have chosen to return in person and 60% who have chosen the virtual academy. It allowed them to make that decision based on a comfort level for them at the time, realizing that we're still in a pandemic, and also developing protocols and communicating it in so many different venues. So I feel that we have delivered what we said we were going to. We acknowledge the fact that we were going to have challenges, not only with the technological issues that we might have, some glitches along the way, and connectivity. We also recognize that we had various levels of readiness for our teaching staff to deliver on an electronic platform. So the professional development changed for us here in Waterbury. The teacher work groups changed, and how we were going to get power users to help prepare each other when we needed someone to teach us how to do something that we didn't feel comfortable doing in preparation for the students coming in on September 8th. We had our attendance today. We believe that we have approximately 17,000 of our students that are either in person or virtual. We're going to continue to be flexible, and we've had to be flexible from the very first day. And distribution of technology for someone who perhaps didn't realize that school was starting on the Tuesday after Labor Day and forgot to come and get their computer on the Thursday or Friday before school opened, to helping students and teachers with logins and how to connect with their teacher. Our model allows our teachers to connect with students while they're in the classroom with the teacher, as well as virtually with the teacher. We did that to prepare the class rosters and enabling the students to know each other and see each other in real time, but some are in person and some are virtual. The teacher prepares one lesson for all of the students and connects with them in person and virtually all at the same time. And that has been quite new and different for our teachers to deliver in that method, as well as some asynchronous learning that we continue to develop on a Google Meets platform. So that's where we are now. And in day 3 of a reopening of a school district, we have had to practice our actual protocols for identifying what happens if someone is either testing positive for COVID or if someone believes that they could have the symptoms but have not tested positive. So we've been tested in that realm the Friday before, actually. So we put our protocols in place. We did the appropriate notifications, and then of course we opened schools, and every single day, we debrief so that we could learn from what happened and we could establish a better day for the next day.
Awesome. Thank you so much, Dr. Ruffin. There's a lot to be learned from all of your experiences. So our next panelist is Simrin Khan. Simrin is a freshman at Shelton High School, having a unique ground perspective on what it's truly like to be returning to school during this pandemic, including what procedures, testing, and education as a whole look like this year. Simrin, would you tell us a little bit about yourself and what it's been like for you being back at school?
Okay, well, thank you, Brooke. Yeah, I'm a freshman at high school, and being back at school has been a little different. We pretty much it's hybrid or online. So you pretty much either go a certain day, and then what my school did, I don't know if all schools did this, we separated the entire school by last name. So A through L goes one day, and then if you're A through L the other day, M through Z goes to school and you do online, and it pretty much does it like that. So we all experience hybrid, or some of us only do online. It's your choice. And I think that's a good idea, because I pretty much separate every desk and put them so far apart enough so that you're safe. But you can also kind of connect with your friends, which I think is a really good idea. And I think as long as you follow the rules, it's enough to protect yourself from COVID and everything. So
Great, thank you so much, Simrin. We look forward to hearing more from you about the things that you've been talking about. Our final panelist is Dr. Mary Armstrong-Hough. Dr. Armstrong-Hough is an assistant professor of public health at NYU, and she studies the interaction between disease, knowledge, human behavior, and medicine. Dr. Armstrong-Hough, can you tell us a little bit about yourself and what you've seen over the past few weeks?
Hi, everybody. I'm Mary Armstrong-Hough. I like that description of my work because it suggests that I study everything. I am an epidemiologist and a sociologist at NYU, but I actually live in Connecticut. And before I started at NYU about a year ago, I spent several years at Yale, first in training and then as a research faculty member in the Department of Epidemiology of Microbial Diseases, where I had the great pleasure of being Dr. Ann Wyllie's colleague for a few years. Before COVID, my background was mostly in interactions among commonly occurring infectious diseases like tuberculosis and HIV. And that meant that my work was actually mostly focused in Uganda and South Africa, not the United States. I actually have only done a few projects in the United States until recently. But as another epidemiologist said on a call this week, I guess we all work on COVID now. So in recent months, I've been working with colleagues at the University of Michigan and the Society for Critical Care Medicine to understand the sources of disparities in survival of respiratory failure among COVID patients in the United States. And I've been also working closely with a number of organizations, including Be Apart, and actually my own high school, in order to try to think about how we can respond to COVID as a community, which is the only way that we're likely to be effective at responding. So as I think about what we've learned in the last 2 weeks as colleges have begun to reopen in particular, I think what's most striking is how much we already knew. We're seeing in the news every day news about colleges that embarked on these frankly risky return plans with insufficiently frequent screening, which are now closing or now experiencing outbreaks. And I think it's unsurprising in some ways that we've already had more than 50,000 cases of COVID among college students and several high-profile outbreaks. But I think that what we learn from that is that making COVID prevention the personal responsibility of students and then blaming those students when things go wrong just doesn't work. And instead, we need to build environments in which it's easy for students and teachers and staff to protect one another. And of course, as Dr. Ruffin was talking, I was thinking, oh my gosh, the thing I'm going to say is probably what all K through 12 experts have always known for their entire careers, that it's about building an environment in which people can make good choices, where it's easier to make the good choice. But I actually think that that is not the first intuition of a lot of people who build programs around the country outside of the K through 12 space. I also think that we need to make it easy for everyone to test frequently. One of the behaviors that we want to see is frequent testing, even when people aren't experiencing symptoms. We want to see robust distance options for learning and for work. And we want to see clear, local, and actually transparent decision rules for when you're going to shut down in-person activities in order to arrest transmission. You've got to know when it's time to quit. And everybody in your community needs to know that too. So what strikes me about all these things is that they're actually the pillars of good basic public health practice. You create healthy environments, carry out rigorous disease surveillance so that you can identify warning signs early, and 3, just have a plan for when a case actually arises. And I should stress that schools around the country have actually been working really hard to implement these 3 pillars. But I also think it's important to remember that schools are not disease control units, and implementation is hard. So just like scientists, educators are on a steep learning curve right now. And the best practices might evolve over time as knowledge advances and as new tools become available. So I guess that's what I'll say. We need to be flexible, we need to keep learning, and we need to keep getting a little bit better at implementing each of these 3 pillars as we go along.
Awesome. Thank you, Dr. Armstrong-Hough. I'll pass it back to Kate so then we could dive into the Q&A portion of the webinar.
Great, thanks so much, Brooke. I just want to say thank you to all of our panelists again for being here, and your insights are incredibly valuable and very appreciated. Now that we know a little bit more about each of you and your backgrounds, we're going to transition into the Q&A portion of our webinar. First, some logistics and context. So I'm going to be posing about 3 to 4 questions about the relationship between COVID-19 and going back to school. We've gathered information from our community members within Connecticut who completed a public survey relating returning to school during COVID-19. We put questions together using this information as a way to respond and push the conversation forward, as well as to inspire each other and ourselves to act. Though some of the topics we'll discuss are specific to certain fields, we want to facilitate an open discussion between panelists in order to gain insight into as many perspectives as possible. We'll spend about 5 minutes on each question, and each of the panelists are welcome to provide input. Throughout the webinar, if viewers have any questions, please feel free to drop them in the chat located on the right-hand side of the screen. If we have time at the end, we'll relay these questions to our panelists, but if we do not, we will be able to address these questions in our upcoming newsletter, and directions on how to access the newsletter will be provided at the end of the panel. Our first question is, some colleges are going above and beyond the CDC recommendations. For example, Yale and the University of Illinois are testing students, faculty, and staff 2 times per week. How do their procedures compare to the minimum recommended CDC procedures to maintain distance, sanitation, and limiting contact for K through 12 schools? Are the CDC's procedures enough or realistic? What means of COVID-19 testing and screening should be available for K through 12 schools? Dr. Wyllie, would you be able to start us off for this? And then our other panelists can jump in with their thoughts.
Yeah, sure. I think it's a very tricky one because I think I've definitely been on the side of that we need to have testing as we reopen, whether it's, I think ideally at least once a week. Of course, anything more than that is going to be more expensive, but you know, this is to sort of protect the health of not only the students, but also any of the staff, whether it's teachers and then also the community, you know, that you're thinking about the families that students go home to. So for me, testing has been a real key point in any reopening strategy. I mean, obviously, it's a very limiting factor as well. I mean, and that's the thing, maybe that it should be, because testing is expensive and the resources required for that are not available everywhere. I think at least, you know, those very minimum regulations that the CDC does have in there in terms of just making the point, you know, known about masks and distancing can go a long way. It really does. I mean, there's this great example just put out there about, I don't know if anyone's seen it, but the CDC did put it out, of 2 hairdressers who were infected with COVID-19. They wore their masks. You know, they saw, I think, about close to 200 individuals, and they did not pass COVID on to anybody. The thing is that masks work, so they are good if people are adhering to them, social distancing, and particularly, you know, hopefully while the weather's nice, more things can be done outside. We do need more testing though, especially moving into the flu season, especially as activities will have to move more and more indoors. But what I'm also hoping is that as we sort of, maybe, you know, over the coming weeks, we're going to see more testing options become available. And I mean, sadly, I think as we've seen examples from the rest of the country, having it highlighted like how important testing is for us to going forward.
Yeah, just to chime in, and really mostly reflecting what Dr. Wyllie has already said, the recommendations of maintaining distance, frequent cleaning, limiting contacts, these are all really important practices anywhere where people gather right now, including schools. They can be very effective, and their purpose is to reduce the likelihood of transmission and therefore slow COVID spread. What places like Yale and the University of Illinois are doing adds a whole extra layer onto that, right? They're testing enough people frequently enough to catch new infections and identify new outbreaks early, hopefully before they evolve to the point where they might have catastrophic consequences. You know, in public health, we call this disease surveillance, right? So they've built these disease surveillance systems within their communities. And you know, that I think is really, really important. I think Dr. Wyllie and I are in close agreement here. The way I would put it is, think of it like an alarm system at these schools, at these colleges where you're having testing happen weekly or even twice a week, that the alarm is set to be pretty sensitive. You know, it should go off within days of a new infection. And so while that alarm going off doesn't accomplish primary prevention, it doesn't stop those first couple cases from happening, it does enable secondary prevention. So it can prevent 5 cases from rapidly turning into 50 before anybody has really noticed. At a lot of colleges, the alarm has been set with a much longer lag time. It's a lot less sensitive. And the way I think about it is, if a burglar broke into your house, do you want the alarm to go off right then, or do you want it to go off in 2 weeks? Personally, I'd want it to go off right now so that maybe I could call somebody to help me do something about it and not find out about the broken window 2 weeks later. So testing.
I think from our school system perspective is that what we found is we have followed the CDC's recommendations and guidelines along with the health department and internal, meaning between the municipality and the school districts crisis management team. And what we found, however, was that some of the testing took a very long time for the results to come in. We've also had several issues with maybe a false negative, and then later on it was a positive. So the protocols that we developed, our school system took into consideration. So what happens if? And we were able to communicate that with all of our families, all of our principals, everyone. So we have a scenario of what ifs. And then of course, those are always tested as something happens. And then you say, well, we didn't write that into the script, so let's rewrite it because this situation says you were negative, now you're positive. Let's do the contact tracing, which we were able to do, and immediate notification. What we found is that it requires an entire team to really make that work effortlessly, and that people should depend on your being able to deliver on your promise of notification very timely. So we were committed to doing that immediately. Immediately means as soon as we have a notification protocol, then we contact the entire membership of that school staff to notify them. Thus far, it's only been notification of staff members. We have not had any COVID positive student cases. And then while we did experience some lag time in getting the results back, we do have 2 sites that in the Waterbury area that will do rapid testing. And we were able to incorporate that in our communication to our parents and to our staff members, because a quick turnaround result is really important for us to maintain health among everyone within the school system. So that's what we're doing to comply. We do not require testing. We have not been able to do that, but I can see certainly the benefits of having testing. I would think that it would be extremely challenging for us as the K-12 system to do testing every 2 weeks.
Yeah, I mean, I can only imagine. And I think that really points to the need for better and more cost-effective tools, which I know is part of what Dr. Wyllie is working on.
No, indeed. And I'm hoping that we're going to see more and more of these sort of enter the market sort of in the coming weeks or months. So, you know, we have developed a cheaper test, which was exactly this sort of scenario in mind. So to make a test that was cheap enough that could enable more people to have more frequent access to testing, and also to start opening up, you know, increased testing capacity locally. So indeed that you don't have to be sending away samples to, you know, across the country to different reference labs where they just all get piled up. And indeed, you know, we need test results within 24 hours, you know, same day would be great. So we're hoping that by, you know, providing this method to local labs, especially here in Connecticut. So we have been working with Jackson Labs to hopefully get this up and running. You know, there's a small lab at Yale Pathology who will be doing this. I think there's also another lab, L2, I believe they are. But the same thing, that we can just get more testing locally and then more access for the education system here, that we can just have a better handle of what's going on. But I also just have to highly commend you with the contact tracing program. I mean, there's a lot to be said about really good, efficient contact tracing. And I think if you've got a system like that in place, you know, indeed, if you don't have the ability to do the testing, I think it's really great that you do have other systems in place that can try and account for that. So I think, yeah.
Great, thank you. Simrin, can you talk a little bit about what you're seeing at your schools, and do you feel that these procedures are actually being implemented, and do you feel that they're successful?
Like the contact tracing procedures and like.
Yeah, and how school is looking, like when you go to school, and how is it different?
As long as we I believe that as long as we follow like the procedures and the rules and like make sure that we're trying to spread at least like the least amount of germs as possible, I think it is pretty effective, because I understand the risks, but it's also we shouldn't have to like be super isolated, but as long as we're all careful, I think we're all okay.
Awesome. Thank you so much for those great responses. So that's going to bring us to our second question, which is students, parents, teachers, and staff still have questions about what happens if somebody gets infected with COVID-19 at school. What should be the standard response or procedure if this happens? Will they have to use sick days, paid leave, online classes, or begin homeschooling? And do teachers or students have the option of opting out and learning or teaching remotely? So for this one, Dr. Ruffin, do you mind starting us off and then the other panelists can hop in?
Thank you. Well, I have several answers to all of these because we've actually been tried on all of those. We have a posted protocol that's on our website for everyone, and we've shared it with all of our staff as well as with parents, but we also post it on social media as well. So we have very clearly defined protocols, what happens if or when, and including who is to be notified first, and the chain of within the structure of who that person contacts, and then who contacts the nurses and the health department, and also the contact tracing, and who's going to make the phone calls to the people that have been exposed to the individual, and what are the procedures for them to self-quarantine for 14 days and or to get testing, where do they get testing, and how soon those results are going to be coming in, as well as how is it communicated back in a confidential way, because we do respect everyone's confidentiality. And so those protocols are established, and as I said, we've actually utilized those. And what we have also found that in some instances, when there's close contact to someone who is tested positive, that person is quarantined for 14 days, and we recommend a test. Everyone thus far has followed that protocol. They've returned the test, and they've communicated that in a confidential manner. Our staff members do not have to use sick days in terms of using the ones that are a part of the standard hiring process for our K-12 staff members. There are other means of allowing days off or time off without utilizing the staff member's sick days. And if a person feels that they are not feeling well, but at the same time they're still able to deliver in an online platform or receive instruction in an online platform, they certainly have that option. And what we have found is that, most people, if they're just not feeling well, they do want to continue to working online, and they have access to do that. For our students who may not be feeling well, we've not had any COVID positive, but when students don't feel well, they still have the option of either logging in to some asynchronous learning in the afternoon, and if they feel well enough to connect with their teachers in person, online, they can do that as well. Both of our in-person and online learning platform is optional. And we've had the majority of our teaching staff, over 89% of them, have chosen to return in person. And some of our 89% returning in person teach a large number of students that have chosen to remain virtual. So we have a blend of both. And we communicate frequently. We want people to feel comfortable in learning and teaching in either environment, as long as we have some advance notice and we can provide that platform and make certain that people are not coming to work or coming to school ill for fear of missing out. That's critically been important for us.
Does anyone else have any thoughts about that one?
I guess, just to add that what Dr. Ruffin has said sort of aligns with a number of best practices, the first of which is test, trace, isolate, repeat. Having protocols in place and having a team in place that has the capacity to carry out contact tracing is really important. being in sort of close communication with your community so that when contact tracers reach out, they're actually listened to, and the information about the potential exposure is taken seriously and acted upon within a short period of time. Those are all really, really important. The other best practice that I hear and what Dr. Ruffin has said is about empowering students, teachers, and other staff to stay home and to do the things that are necessary to keep one another safe. Finally, having these easy to understand decision rules and protocols and contingency plans in place so that you're not having to constantly make decisions on the fly, right? This is the point of protocols, this is the point of checklists, so that we can agree as a democratic community, so we can reach consensus about what ought to be done, and rather than have one poor soul be desperately trying to make decisions under pressure, have a roadmap for what to do when these things happen. And you won't have a roadmap for everything, as Dr. Ruffin has said. You're going to encounter these things that you didn't anticipate, and you're going to have to come up with something, but then you document what you did, you documented whether or not that worked, and every time you go through these cycles, you're going to iteratively get better.
And I think sort of just touching on things that have already been said sort of to some extent as well, but I think what's just also really important in it all is just overall having a supportive environment, a supportive community. We want, whether you're a student, whether you're a staff member, whether you're another employee, associated with the school, we want these people to feel supported, and if they do test positive, that that their lives or their education aren't at risk, their jobs or their education aren't at risk, that they feel compelled, that they're supposed to still be coming in, or that they are going to have to sacrifice annual leave, or if they're going to have to sort of miss out on important assessments, that, if you can create supportive environments that encourage people to feel that it's okay to step back and isolate when they need to for the health of everyone else around them, that is also what's just really important to have for the health of all of our communities as well.
Great, thank you so much. Our third question of the night is, COVID-19 is clearly not just a bad flu. Young and healthy people do get sick and die from COVID-19. Where does the responsibility lie for potential illness, medical bills, and mortality? Will the schools or government aid in covering medical costs if students, teachers, or staff fall ill? Dr. Armstrong-Hough, would you mind to start us off with this one, and then everyone can jump in with their thoughts?
Oh gosh, I have no idea how to answer this one. I think that you need a legal scholar in here to answer this question. What I will say is there has been this rhetoric of making this all, everybody's personal responsibility, but institutions have responsibility. Leaders are called leaders because the buck stops with them and they're expected to exercise leadership. I think that this is an interesting case where, all of us are citizens, and we're members of communities, and we, should do what needs to be done to take care of one another and follow through with what we owe to one another. At the same time, it's not unreasonable to look to institutions, including schools and including her government, and expect them to come up with a plan that will minimize the harm from this disease. And I think that that's all that I can say. I actually don't know the answer about legal responsibility.
I think ethically, we have a moral obligation to help, not just with money, but helping make sure that everyone else is safe, making sure that many more people get affected by this.
Absolutely. And I think that what's interesting is that some of my work is on pro-social behavior, things that we do that primarily benefit other people. Why do we do those things? And what's really interesting is that most people most of the time will do right by the people around them, as long as it's easy for them to do so. But so here's the question: what makes it easy for them to do so? social norms make us behave in certain ways and not others. Rules of institutions. There are sort of having rules in place that are handed down by our schools, by our workplaces, by our governments that we can all agree on, make it easier for us to do the right thing. And so I think that we all have this individual moral responsibility, as you so eloquently put it, Simrin. And I also think that our institutions have a moral responsibility to us to make it easier rather than harder for us to protect one another.
For Waterbury, what we also realized is that in getting the right information out to our families, we needed to be very quick and efficient in getting the information out in multiple languages, and making certain that we were not to assume that because we placed everything on our website or on social media that some of our most vulnerable communities would have easy access. So getting that information out to other agencies that had connections with our families and were able to explain to them the procedures and how to feel safe. For instance, at the beginning of COVID, many of our families, even if they were ill, did not feel comfortable going to the hospital. They were afraid of going to the hospital because they thought that was going to be the place where they were going to get even sicker. So we had to make certain we disseminated the correct information and make certain that we at least tried. And when I say at least tried, trying is not good enough because we want to assure, but you do have to try to assure that you're reaching your most vulnerable communities. So a couple of the testing sites were actually placed in our most vulnerable communities, so they did not have to go to the hospital to get a test. And then communicated in agencies such as faith-based organizations and other agencies, like for us, Reba Espera, which really services a particular part of our city with many Spanish-speaking students and families who may not go to the school to get the information, but they'll go to a center to get the information. We had to be quite strategic about where we were going to place this information, as well as our community forums, make certain that we touched on all of the different staffing groups from because we have several unions, and every union had different questions based on their employees, their paid leave. So we went out and spoke to all of the different community groups to explain what a medical leave would look like in COVID, because it wasn't something that we wanted our staff to be afraid of. We wanted them to know what their options were. They were not going to lose pay. They were not going to lose their jobs. And they could take certain types of family leave. And it's a complex system that we wanted people to feel comfortable with knowing. So where do you go if you still didn't get your question answered, but you don't want to ask that question in a public forum? So the names of contact people from our human capital department, so that they could get personalized answers to their many questions about medical, about family medical leave, about sick leave, about leave that was not going to be costly to them or their families. And we're still doing that. We do that every single day. And we do have a 24/7 crisis management team here in Waterbury that responds to calls, either 211 calls or other calls to answer questions that people seem to have, 24/7. And that's how we're responding to a community with various questions and in multiple languages in Waterbury.
That's amazing. Thank you. Our next question is directed towards Simrin, and then all of our other panelists can chime in with their concerns as well. So Simrin, what do you feel are the biggest concerns amongst you and your peers, your friends, about going back to school? And do you feel that there are systems in place to support you guys going back to school?
I think the biggest concerns is like making sure that we're still isolated, but still are able to connect with our friends, but as well as like still learn and be able to do like all the activities we want to do, like in high school or like in any school really, because like you still want to experience like the fun parts of school, because let's be honest, like not all of us enjoy like learning all day, because we spent all of last year, like in the spring, learning at home. So we want to try to do something fun. I think that's our biggest concern, being able to do that, but as well as like keeping each other safe, but as well as connecting. And I think that what the schools are doing, like as far as I know, I think that they are like doing it. I think it's fair, but I think that like with everything going on, that like we can't really all expect that like everything will get back to normal very quickly. So what they're doing right now, I believe that it's fair. I believe it's working because we're all able to connect, but as well as like stay apart, like distant, also we all can be safe.
Can I ask Simrin a question?
Sure.
What are the the school activities that make you feel most connected right now to your peers?
I guess like clubs and like all those indoor things you can do. There aren't many like activities like you can do. It's like clubs and all like organizations, like hanging out like outside, like distant outside at school, just by hanging, like going outside and like actually like experiencing hanging out, but as well as being distant. I feel like that's like the most connected I feel with my peers.
When you get to actually see them, but be outside.
Awesome. Does anyone else have any thoughts about what their concerns are? No, okay. Go ahead.
I was just gonna say, you know, I'm concerned about fatigue. You know, like I think that I don't teach K through 12 students. I don't even teach undergraduates. I teach graduate students, and I was really moved by how hard they all tried last spring and how flexible everybody was. And I'm seeing a lot of good cheer and maturity and flexibility with the beginning of this fall as well, which is amazing. But I think that what we're all learning is that this is a marathon, not a sprint. And so the concern that I have is sort of that, you know, that we're all getting COVID fatigue. And so we need to keep reminding ourselves of the first principles of why we're doing this. That's for each other, right?
Yes. All right, awesome. Thank you. So now to move on to our last question. Connecticut is highly dependent on property taxes to fund schools due to a lack of resources and funding. Many schools are more likely to have high numbers of students per class and smaller classrooms. Connecticut has also one of the widest achievement gaps in the country. How effective can social distancing procedures be in Title I schools? How will COVID-19 schooling affect the education gap? And what options exist for students with no at-home internet to learn remotely? And then what resources do these districts need most? Dr. Ruffin, would you mind starting us off again for this one? And then everyone else can hop in.
Oh, wow, Brooke. I think we're all working on this one simultaneously. And certainly we know that you know, school districts are not funded to the full capacity in our school funding formula in Connecticut. We've certainly experienced that, but Waterbury is one of I think 13 other school districts in the state that are funded in addition through the Alliance Fund. So we do receive additional funding there, but that too could be insufficient, especially when you recognize the need for a real robust social and emotional learning platform for all students within our district. So the funding continues to be an issue. However, this year, you know, because of the CARES Act and because of other funding that the governor has made available to us, we were, and districts across Connecticut were able to receive additional funding to use for social and emotional learning, transportation, the academic and the technological development of their school districts. That was a huge help for us. What we need to do, however, is to strategically balance that funding because it is not promised as a reoccurring fund. So we can't just spend it and not be aware that whatever we're going to spend it on, it needs to really have a return on our investment, and it has to impact our students in a very meaningful way. And we're cognizant of that. The educational gap, what we found is that, yes, we certainly have an educational gap, but I think the gap that we discovered during COVID is an even more egregious gap, which is the digital divide. And it's not just in the ownership of a device, but it's the various levels of comfort working, teaching, and applying technology, not just to take a test, but applying it now. It's a part of your teaching and learning and growing and developing on any level, whether you're in a pre-K-12 system, collegiate level, or taking care of the elderly at home. Technology is really that huge gap that has really been an eye-awakening experience for all of us. And in my opinion, it's going to take us many years to really get to where we should be, but we are catapulted into this new world that I think we can also be creative and rethink things and reimagine things and not try to make them the way that they were years ago, because I don't believe that that's the direction we need to take. I think we need to be innovative. We have new technologies that are being developed every day. I think we need to take advantage of that, and we need to encourage our students to be innovative and creative. I think they're going to live up to that challenge. So the educational gap, while it does exist, and it's that digital divide that has made it even more apparent today, we also have to recognize that before you can take care of the educational state as we return to school in person for the first time in 6 months, is that we have to take care of the child and the basic needs that sometimes we take for granted. But when you're looking at trauma, when you're seeing students coming to school whose parents may have lost their jobs, you have, we have experienced students who may have had a loss due to COVID-19. Maybe they've lost a family member. We have staff members who have lost family members. All of those things impact where we are today in the pre-K-12 world. And so taking care of people, I think, is essential. And people must know that we're all in this together, but it's very challenging. And so when we have colleges that are now sending students home because they're having to close, we have to realize that some of our staff members have children coming back home, and that's it's the whole it's just the whole dynamics of everything that's happening in the world today that impacts what we're doing in not only the K-12 system, but in educational systems across America. It's not just resources, it's how we're going to be able to rethink and utilize those resources to move forward in a very innovative world that takes us away from the traditional.
Dr. Ruffin is so much more an expert on this than I am. I'm really struck by those comments. And one thing that I thought about as you were talking was how, what has effectively happened when in-person learning is interrupted and everyone is expected to connect from home and learn at home, is that the responsibility and the cost of creating and maintaining an effective learning environment has been outsourced to all of these families and all these households. And that's something that obviously there's going to be different levels of resources for responding to that challenge, but it's also something that we as a community should be putting resources towards, right? Like there should be a stipend to make this happen, to create more comfortable and more effective learning environments in people's homes. If we're going to say that now every third grader has to be doing their homework at the kitchen table, not all third graders have a kitchen table. So I hope that that's going to frame our political discussions as we go into an election year and we think about what kind of country we want to live in, because right now we need something like a universal basic stipend for home learning in order to just get the resources that are necessary to take advantage of all the amazing programming that you're making available online.
I have a question for Dr. Ruffin. Do you believe that the resources you have are effective enough for your students?
I don't believe that they're reaching to the full level that we want them to, Simrin. I don't believe that, I don't believe everyone knows how to utilize the resources that are available to the level that, someone can feel comfortable teaching their children at home and not feeling that they have to be the teacher, but how do you navigate that when you may have 2 or 3 children and they have 2 or 3 different teachers, and you're a parent and who may have to be home now when you would have been at work? I think that resource, that how do you apply maybe a new concept that hasn't been implemented full range yet to help that family who's struggling with, what do I do now? I think that is a missing resource, and it's not so much about money, but it's about how do you structure that so that you can help, as opposed to just saying, well, your children are home, somebody has to teach them, I'm making it available in the school system, it's up to you to figure out how you're going to connect. I think that's a gap right there. I hope I answered your question.
Does anyone else have any thoughts? Oh, okay.
I guess I had a question for Dr. Ruffin as well. It's just sort of what cohesion do you see across like the whole of Connecticut with the different school districts and the sort of different plans that are in place? Like, is there much communication, sort of knowledge sharing, experience sharing, bouncing things off each other, support, or is it sort of left to sort of your own sort of local communities?
I think we have a great opportunity to collaborate and to talk with our colleagues across the nation, actually, to examine best practices. I think what most of us find ourselves in is that we're all experimenting. We're doing the very best that we can for the community based on what we know now. But we have an opportunity perhaps that we need to expand on, certainly in the coming months, where we can collaborate and share best practices, because I think some of us will experience some success at some things and failure at others, and then, and maybe vice versa. So it's going to be important that we create that network. And I think now with the virtual opportunities, we could do that, with the world, to find out some of those best practices and incorporate that. Time, of course, becomes problematic because you need the time to be able to do that kind of collaboration. But I think in the absence of that, then you're working in a silo. And we received lots of guidance, but we didn't receive anything specific, so we're all kind of navigating our own right now. That collaborative piece is going to be huge for education moving forward in the years to come.
Anybody else?
I have another question for Dr. Ruffin. What are you what are your plans for activities for your students, so that they can also experience that part of school, like the activities and clubs and everything? What are your plans for that?
What we've done is we've utilized some of the online, online field trips We've also engaged in some of our teachers have been creative and innovative in their fine arts and the delivery of that instruction, so our students can actually participate even if they're not there in person. We've also done some virtual job shadowing because we wanted to continue to develop our career pathways, and that was very hard to do if either students didn't feel safe going into an employment or into a business, or the business had some limitations, but yet they wanted to open up their field or their offices or their manufacturing firm or the teaching and learning room so that our students can have that virtual experience. We've also allowed for students on a limited basis to actually go out and to do those job shadowing in person, but it's much more limited than it was when we didn't have that cap or we didn't have to be so socially distanced with COVID. We found some creative and innovative ways to connect with students and offer like group settings, virtual of course, but for students to meet and to discuss and to dialogue online. And while it's not as good as that one-to-one or that small group talking in close proximity to each other, it does afford the students opportunities to engage in that conversation. We haven't stopped all of our clubs. We haven't stopped them all, and we don't want to. What we want to do is to practice the social distancing while still allowing that, because I agree with you. That's what our students miss the most, that socialization, which is such an important part. So we didn't stop it all. We just have to rethink how we're going to make that possible for our students, perhaps in a different setting.
Yeah.
Awesome. Okay, I just want to say thank you to all our panelists. We are going to have to close it off now because it is 7 o'clock. We don't have time to answer any of the audience submitted questions, but we're going to try our best to answer them in the upcoming newsletter. But we want to thank you all for your questions, comments, and feedback. With that being said, I'm going to pass it to Kate for some closing remarks.
As COVID-19 progresses and we continue to operate during this pandemic, how we enter this school year will be an important factor when it comes to affected families and ending the pandemic. I understand this can be stressful and maybe disheartening, but it is really important to be proactive and to address these problems before they become a reality. Conversations like these allow us to spread hope and awareness and to create a path for solutions. I do want to take this time to thank all of our panelists again for taking their time to engage in this educational discussion. We also want to thank our sponsor, 4.0 Schools. 4.0 provides coaching, curriculums, and cash to foster more equitable futures. Recently, 4.0 granted Be a Part a 6-month fellowship to develop educational tools to support Connecticut students so they can make responsible, safe decisions to help their community this fall.
Thank you, Kate. So in addition, Be a Part understands that going back to school remains a concern for many parents, families, and teachers. As a nonprofit, we remain committed to our mission of educating youth leaders to tackle issues in their communities. Be a Part will be launching a mentorship pilot plan for select high school students. It will consist of topical webinars, partner-led panels, and growth opportunities. We encourage everyone to share this opportunity. More information will be provided soon via our social media and newsletter. There's also information that can be found on our website, which is www.beapart.org. If you look at the top of the page, there are links that say voting options and take action, and that one drops down to stay connected and voting challenge. Chris will also drop some links in the chat for more information as well, so feel free to click those and check them out. Be a Part's next major initiative is to encourage safe voting in a pandemic. We'll be providing updated information and educational tools starting now through November. We'll also be partnering with civic and education nonprofits here in Connecticut. So please follow our social media pages on Instagram and Facebook, both of their apps being Be a Part with 2 underscores. And we also have one more thing to ask you all before you go. There are several ways that you can support us, but for now we have one ask. While you're here with us, go to our website, which as I said is www.beapart.org. And then if you scroll down, there's a blue section. If you could enter your name, zip code, and phone number and email into that section. We'll be sending out a newsletter and survey with some next steps and new initiatives in the upcoming days. So I'll give everyone a moment to enter your information into the blue section.
Thank you, Brooke. It has been an awesome experience working on this panel with the entire team, and we really look forward to hosting more conversations like this, so keep an eye out on our social media for upcoming events. Thank you to everyone who submitted questions and came to our panel today. Thank you to our incredible group of panelists, and thank you everyone for being here. Thank you so much for being a part.
Thank you.
Yes, thank you.
Thank you.
Thank you.
Thank you, everyone.